Hi, welcome to Suman TV viewers. I am Dr. Chava Anjaneyulu, Senior Consultant ENT Surgeon and Chairman for Asian ENT Care Center. Asian ENT Care Center is an all advanced diagnostic and treatment facilities, especially with laser, microdebrider, coablator. All advanced equipments are available to treat ear, nose, throat problems and hearing problems. Sinusitis is inflammation of the paranasal sinus. In body there are many sinus are there, but the sinusitis commonly we use for the inflammation of the paranasal sinus. This sinusitis may be due to allergy, infections may be bacterial, viral, fungal infections. Sometimes granulomatous disease, all this cause the sinusitis problem. The most common reason for sinusitis is the allergy. Because all allergens goes through the nose and enter into the body with the air. These pollutants will enter into the nose, cause persistent inflammation of the turbinates and the sinus. So edema and inflammation, edema and swelling cause the closure of the ostia of the sinus. That means drainage of the sinus get blocked. There these secretions accumulate and get the sinus. This hypertrophied mucous glands also cause the polyp problems. So hypertrophy and hypersecretion both are the reasons for the sinusitis in allergy patients. In allergy patients, there is a more chance of the bacterial, viral and fungal infections. Recently we saw in COVID pandemic, there are many cases of the black fungus infections, especially in allergy patients and diabetic patients. This allergy causes edema and swelling of the tissues. Diabetes provides ketotic environment. Both together helps or provoked the multiplication of the bacteria, virus and fungus. That means this provide the environment for their growth. So patient goes into severe sinusitis. Sinusitis problem usually we diagnose by the nasal endoscopic evaluation and paranasal sinus CT scans. Endoscopy especially will tell you about if there is a black fungus. Immediately on surface itself you can see it, what is the nature, and send for biopsy. You confirm the diagnosis, treat very early. CT scan will show all the sinus status, maxillary sinus, ethmoid, sphenoid, frontal sinus, how many sinus involved, how much intensity is involved. And more important, it will help to know the severity of the disease, sometimes mainly fungal infections. Hyperdense areas, whenever there is a hyperdense areas in the CT scan, never neglect, do immediate surgery, otherwise it will go into the invasive fungal sinusitis. Usually sinusitis patients will have the problems of nasal obstruction, nasal discharge, facial pain, cough, postnasal drip, sometimes eye disturbances, eye strain. All these symptoms are in favor of the sinusitis. Whenever patient have these problems, get the CT scan of the sinus and find out the reason. Usually sinus disease, if we cure all types, that means from allergy point of view, infection point of view and allergy point of view, so usually patient will get a complete cure. Many patients think that they will not get a permanent cure for the sinus, but nowadays many patients are getting very good relief and permanent relief regarding the sinusitis. We treat these patients both by medicines, surgery and immunotherapy. If we treat the patients from all sides, if anatomical abnormality is there, you correct with the surgery and remove the residual sinus disease. If allergy is there, you treat that with the surgery. Persistent allergy, you do immunotherapy. And if persistent allergy is there, or if there is any provocative situation for that patient to get the symptoms, use the medicines. So by using medicines, surgery and immunotherapy, we can cure the sinusitis problem. More important, preventive measures are very important. Don't expose to the unhygienic environment. Do regular breathing exercise and do jalaneti. All these will help to prevent the sinusitis. If you have any sinus problem, either nasal polyps, sinusitis, allergy, contact Asian ENT Care Center where they do all investigation and treat you with medicine, surgery and immunotherapy. You can get a cure. For further updates, subscribe Suman TV.